Prashant Yadav is a senior fellow at the Centre for Global Development and a professor at INSEAD. He lectures in global health and social medicine at Harvard Medical School in the US and has a particular interest in healthcare supply chains and operations management. The perfect person to give us a snapshot of where the world is in terms of its vaccination programs. Welcome to DW. In those countries that have vaccination programs, where is it going well and where are you seeing problems?
So I think as the news reported, Israel is a country where we're seeing very fast rates of vaccination. Part of it has to do with how the planning has been put in place before the start of vaccination. It also has to do with the underlying structure of the health system. We see considerable heterogeneity in states across the US. We also see some countries in the European Union doing considerably better as compared to others. I think in the end, it boils down to how well is the system communicating information in two directions, one being from the central planning, the federal agencies in a country, to the last clinic, which is vaccinating, and then information flowing back from the clinics to the planners at the central level. And I think there are countries which have managed that well, and there are countries which haven't. The second part, which is important, is we focused way too much on just thinking about, do we have sufficient supply? And I think that is important. But at the same time, in the end, it is about matching demand and supply. And the techniques for matching demand and supply require us to think about prioritization, dose reservation in ways that are different than just when we're working with a scenario where it's about scarce supply being allocated to known demand.
I'm intrigued by this idea of matching demand and supply. So it's not just as simple as get as much of it out to as many people as we can.
Yeah, so think of it this way. In the US, we started with the idea that we would do sequential prioritization, which means we will first vaccinate our phase 1A, then we will go to phase 1B, then to phase 2. And what that does is if the number of people who are supposed to show up at a clinic from phase 1A in a given day ends up being less, then we have extra doses, which we then need to figure out what to do with them. But if instead we do parallel or simultaneous vaccination with the priority being kept for those who are in phase 1A, then it allows us to match demand and supply better. The second is if we fragment the demand into multiple smaller clinics, then the uncertainty in demand in each clinic is higher. But if we pool it and do it in a mass vaccination clinic, such as a stadium, a community center, a parking lot of a large hospital, then I think we pool the demand, and as a result, we are better able to match it to the given supply.
OK, that's very clear. I want to listen now to the Executive Director of the World Health Organization, Mike Ryan, speaking today in Geneva, warning that vaccines are not the sole solution to this pandemic.
And we did also warn in 2020 that if we were to rely entirely on vaccines as the only solution, we could lose the very control measures that we had at our disposal at the time. The vaccine is light at the end of the tunnel. It is a hugely, it's a massive advance, but it doesn't answer and it won't address every question that we have. We have to continue doing the other measures.
Right, so Prashant Yadav, it sounds like that even if we do have mass vaccination programs and they are successfully rolled out, we're still going to have to wait some time for a return to a maskless society, if I can put it that way.
Yeah, so we have to keep in mind that vaccines are our most important tool, but not the only tool. And we have to continue with multiple public health interventions, whether it is use of masks or social distancing or better ventilation, tracing, isolation. All of those measures need to be kept in place. The rate of vaccination will help us get faster to a point where we can do away with them, but we are nowhere close to that yet.
And so when does it stop? Because it sounds like, OK, the vaccinations, that helps us get the number of cases down, that helps us to get the test and trace systems working. And so when can we just be normal again?
Very hard question to answer. And again, I'm not an epidemiologist or a person who has the training to be answering this, but my first reaction would be only when we vaccinated a large fraction of the global population, so not just the population in our individual countries, but globally, once we've reached a point where we have 50, 60% of the global population vaccinated, that's probably the time when we can start thinking about becoming a little bit lax with our other public health measures.
And so that fits in quite neatly with something I've been thinking about, because we have this COVAX system where less rich countries can actually pay for these vaccines. From what you've said there, it sounds like it's in everyone's benefit, in the rich countries' benefit, for poorer countries to have these vaccines, because otherwise no one gets anywhere.
Yeah, so it's a combination of both. If we are only in it's both in our self-interest and in our altruistic interest to ensure that there is global access to of safe and highly efficacious COVID-19 vaccines, because it helps the world as a whole, not just populations who live in developing countries, but the populations in high-income countries equally.
Fascinating. Thank you so much for joining us. Prashant Yadav from Harvard University Medical School.
Thank you.